Afternoon. Welcome to today's Wisconsin Health News virtual panel on upcoming changes to the Affordable Care Act in Wisconsin. My name is Tim Stum. I'm editor of the Wisconsin Health News. Thanks to all of you for tuning in today. We have a really great panel with us. I am thrilled to introduce Tommy Ibrahim, CEO of Sanford Health Plan, Carolyn Gomez-Tom, Enrollment Network and Accessibility Manager for Covering Wisconsin, Sarah Smith, Director of Public Affairs for the Officer of the Commissioner of Insurance, Scott Stewart, CEO of the Wisconsin Primary Healthcare Association, Justin Sidner, Chair of the Department of Risk and Insurance for the University of Wisconsin School of Business, and Sean Kirkby, Senior Editor of Wisconsin Health News, who is moderating today's event. Before we get started, though, I want to make sure we thank the very generous sponsors of the Wisconsin Health News virtual series. Healthcare leaders from across the state sign up to watch these virtual events, and they would not be possible without the generous support of our sponsors. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Delta Dental of Wisconsin, Amplify Health, RSM, and Quartz. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. So if you are not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Anthem Blue Cross and Blue Shield, today's featured sponsor. We're really grateful for all of their generous support. Here to say a few words is Ted Osletter, CEO of Anthem's Wisconsin Medicaid Plan.
Thanks, Tim. Good afternoon, everybody. I'm Ted Ostelder. I have the privilege of leading the Medicaid health plan for Anthem Blue Cross and Blue Shield here in Wisconsin. We're proud to partner with the state in Badger Care and SSI programs, helping to ensure our members have access to the physical, behavioral, and social health needs services that they need. Blue Cross and Blue Shield has deep roots in Wisconsin. We celebrated our 85th anniversary this past August. Today, we support Wisconsinites across the full spectrum of healthcare coverage through their employer, Medicare, Medicare Advantage, the ACA Marketplace, and Medicaid. We employ more than 1,000 associates here in Wisconsin, both here at our Waukesha office and virtually across the state. Each year, our team contributes over 5,000 volunteer hours in local communities. And through our foundation, we've invested more than $1 million to support hundreds of organizations statewide. At the heart of everything we do is a simple but powerful purpose: improving the health of humanity. This is a dynamic time in a rapidly changing industry, and I'm really looking forward to today's discussion. So thank you, Tim and Wisconsin Health News and Sean. I'm looking forward to a great conversation here today. Thanks.
Well, thank you, Ted. And thanks again to Anthem for all of the very generous and continued support. And with that, I'm going to hand it over to Sean to lead today's discussion.
Thanks, Tim. The Affordable Care Act market is in flux in Wisconsin. Temporary subsidies have made health plans more affordable and led to record enrollment, with more than 313,000 Wisconsinites signing up for 2025 coverage. Are set to expire at the end of the year. With the start of open enrollment around the corner on November 1st, we thought we'd assemble this panel to take a deep dive into the status of the market. Caroline, I'd like to start with you. Covering Wisconsin helps people find health coverage. What's different about this upcoming open enrollment period and the coverage that's being available to consumers than in prior open enrollment periods? What are you expecting to see that you haven't seen before?
Sure. Thank you so much for having me. I'm Carolyn Gomez-Tom with Covering Wisconsin. I manage our enrollment networks statewide, where we bring our partners together to make sure that people have the information that they need to be prepared for these types of transitions in policy, especially as we get closer to open enrollment. And really what we're anticipating is a lot of change for this upcoming year in terms of essentially the enhanced tax credits, at least as we currently see them ending at the end of this year, which means tax credits will not go away completely, but a lot of people that benefited from more financial assistance to help lower the cost of their premiums will have essentially higher prices to potentially deal with, which means they are going to be maybe not looking at their health choices as their priority, but their financial choices when they're looking at plan options. And then additionally, we, as navigators, so Covering Wisconsin is the state's navigator program, we also were financially hit by 90% cuts in our federal funding. And so that means there's just less capacity in helping people with those options. We will still remain in doing that work, and we'll talk, as much as you'd like in terms of how to get connected to us. But the capacity that we have had is smaller, and we've been working collaboratively with all of our partners to make sure that at least anywhere you go in the state, there will still be some support for people who have questions, because anytime there's change, people know that things get way more complicated, and there's also just risk for just more challenges when people are looking at what those options are.
Thanks, Caroline. Justin, can you weigh in a little bit here? What are some of the biggest changes that we're expecting to see in the market this year?
Well, I think this year, the big impact, as Caroline was saying, is the change to the premium subsidies. So, I think for a lot of people, the estimates are that, net costs, if the enhanced premium subsidies don't get extended, could go up pretty substantially. I think, somewhere on the ballpark of $1,000 or more for many enrollees is what people are going to be looking at. And so I think that's going to be, the first and kind of primary thing. There were a number of other things that, were proposed in legislative changes that I would broadly sort of classify as things that would have increased some of the administrative burdens to enrolling that for this year anyway have been stayed for the courts, at least for now. And so I think, in terms of the way it feels to enroll on Healthcare.gov, it's not clear that that's going to be massively different, but the costs are going up. There's at least one insurer pulling out in Wisconsin in certain areas. And so, there's going to be some people who also need to re-enroll and find a new insurer. But I think the big thing is going to be the change in those premium subsidies potentially.
Caroline, would you like to add something?
Yeah, and I just wanted to add one other thing. And I know, yes, Justin's correct that there have been some pieces that have been changed at the federal level that are currently stayed because of a court case. But there are some items that are going through that add to kind of the complexity of this year. One, this is the first time that something has ever happened where someone or a category of people are losing health insurance coverage access, particularly the folks that have the deferred action for childhood arrival immigration status. And they actually are rolling off at the end of this month from their Healthcare.gov coverage. And then really on top of it, because of some of the changes that are going to happen over the next couple of years, there's just a lot of misinformation and really negative rhetoric around our immigrant community that has also then added to people not wanting to engage with our healthcare system altogether. We've heard from our partners that there's folks that are not going to doctor's appointments, let alone signing up for health insurance that their family needs.
Tommy, I want to get to you for a second, but Caroline, I just had a quick follow-up for you. I believe the DACA coverage started last year, if I'm not mistaken. Can you talk a little bit about what impact we saw in the state from that? I mean, did we see a large, I know we saw a large uptick in folks signing up, but I mean, how much of that was done because of that extension? And how many folks in that community did receive coverage through that?
Yeah, so I wouldn't be able to give exact numbers. They don't track specific immigration statuses that enroll in Healthcare.gov. We know anecdotally that our navigators and other enrollment assister partners engaged with people with DACA status and got them signed up. We did a lot of outreach with folks that interacted with that community in particular to make sure that they had access to our navigator program. And what we're also then hearing generally from our partners is that just the immigrant community in general are either actively reaching out to maybe disenroll family members because of concerns around sharing of information, sharing of data. And that isn't just specific to Healthcare.gov, but really Medicaid as well. But also just concerns of wanting to engage with the healthcare system. And we've done our best to make sure that we are giving good information and making sure people know what the current policy changes are so that they can make the best choice for themselves. But really, this is an all hands on deck type of effort where we all need to be kind of talking from the same rule book so that people know what information to trust when really they're hearing a lot of different things.
Thanks, Caroline. Tommy, would you like to talk a little bit about some of the changes that folks are facing this year?
Yeah, Carolyn and Justin really commented on what I was going to say, but it's wholeheartedly agree with my colleagues on this. I mean, I think one of the other things that we're obviously sort of preparing for is the potential for the subsidies to actually get approved and extended into next year, which will obviously be a really positive thing for our members and our patients across the region. From a logistical perspective, though, we are obviously preparing for what that would mean. I mean, we anticipate some special enrollment period, obviously sort of outside the usual time frame. And from a logistical perspective, will require, I think, some additional resources on the plan side to be able to accommodate for that influx of membership in sort of an unusual time frame. So, everyone is sort of focused on those potentially expiring, obviously, and that obviously is an important likelihood. But we're trying to remain optimistic and also bracing for the opposite result.
Thank you, Tommy. I want to get into that a little bit further with you a little bit later in the panel. I want to step back for a second, though, and talk. So, Justin, can you talk a little bit about what specific populations these expiring tax credits could hit the hardest if they do expire?
Yeah. So, the first group that gets hit hardest are, what we'd sort of call the more middle income enrollees in the ACA. So in particular, the enhanced premium tax credits extended some subsidies for people who make more than 400% of the poverty line. So that group prior to, that change had not gotten any subsidy and were having to pay full cost. And so for, the last few years, they've been getting subsidies, and that's led to some increases in enrollment from people who didn't have employer-sponsored healthcare but were in that sort of zone. But the changes overall actually impact a lot of other people who otherwise will remain eligible for subsidies but had much improved subsidies. And so there's even all the way down to people who right now or the last couple of years may have been eligible for a plan that was net zero premium to them are now potentially facing a relatively significant cost for those premiums.
Thanks, Justin. Scott, can you talk a little bit about what populations you're concerned about in this state? I mean, how are these tax credits affecting patients at community health centers?
Yeah, and so that's a great question, Sean. And for us, our bulk of who we serve is on Medicaid, but we also serve a key population of folks who are on the marketplace plans. And so, if you look at our data across the board, about 10% of the patients that we serve, of the 300,000 across the state, are on commercial plans. And in my estimation, most of those are probably marketplace, right? I think, we don't have good data systems that necessarily capture that, but most of those are marketplace because we serve those who are under, about 92% of the patients who come through our doors are under 200% of the federal poverty line. And so that's our concern, right? As well as a lot of the immigration concerns and those kind of, challenges that we see. And I'll highlight for us what we find is, we are required to serve anyone who comes through our door, regardless of insurance status, regardless of whatever happens, regardless of anything out there, regardless of immigration, all of those different pieces. And so we've already seen, I think to what Caroline said was, we've already been seeing, an increase and uptick month by month in our uninsured rates at our health centers. And the more that happens, the less sustainable we are and the less capacity we have to continue serving because of those challenges. And so I think for me, that's, I think, one of the key challenges that we see is this impacts our provider community extensively. And I also think it doesn't necessarily meet the goals of what we want in our insurance program, right? The goal of Marketplace was actually great, that you could get people on a pathway off of government sponsored insurance. And now we are cutting off that pathway and either making people get off insurance or really stay on those pieces without really having any option to move into better moves in their pieces. And so that's what we're seeing on the community health center level. I will say one thing just to highlight is that we are now also trying to really invest in our community outreach and enrollment and eligibility assistance. But again, that's challenging right now because there's also just not, there's so much uncertainty out there and so many competing messages that, even, as Justin was speaking around some of the things that were stated, it was like, oh yeah, gosh, like what was stayed versus what's not. And there's just not enough time even to be able to really have a meaningful campaign to talk to our patients to say, hey, here's what's actually happening because things are changing every 5 minutes, right? And so that's some of the challenges that we're facing on the ground.
Got it. Scott, just to dive in a little bit further with that, can you talk a little bit about how these changes are impacting safety net providers? I mean, you mentioned before about seeing more folks who may lack insurance coverage. Are you anticipating revenue loss from some of these changes, and what will that mean overall for what community health centers are able to do?
Yeah, absolutely. I mean, I think, I know with this is focused on ACA, we also have a lot of things happening in Medicaid. And I think that's just, we can't, while even in the state, our departments are separate on that. For us as on the ground providers, that does impact us on both ends, right? And so we are facing what I kind of call is like just consistent challenges and a death by 1,000 cuts, right? Like we gotta impact all of these pieces while we know that the safety net is there and we're going to be required to have ways that we serve more patients with less capacity, with less financial resources, and no other resources that are coming in our way, right? I will say already at a health center standpoint on a national level, our national association put data together and noted that we are operating at about a -2% operating margin nationally. And so I've already been having conversations with many of our health centers who are actually planning on layoffs already. And so what happens when we have to decrease capacity but that there's more people out there who actually need care, right? Because we really have the double whammy here. We not only have to provide care for our existing patients who lose their coverage, but we also have to care for new patients leaving other providers who don't offer care for uninsured patients, right? And so how do we address that when we don't have additional money coming through the door? I will say, one of the things that helps us with covering the uninsured and was intended to help us with covering the uninsured, but has definitely lost maybe its way over time, has been that we do get federal grant money for being a federally qualified health center, right, or a community health center. And that used to be 40% of our revenue, right, is on a national scale. Well, now it's down to about 12%. Well, unless that money is planning to increase, how do we really continue to serve the uninsured in a really sustainable way, right? When we don't have any other sources and we're losing both that Medicaid piece and then any coverage that we have for Marketplace, right? And all of those things combined are going to really create capacity challenges at our health centers.
Thanks, Scott. Sarah, can you talk a little bit about OCI's role in this? I mean, a lot of this is managed at the federal level, but what is OCI's take on this? Is it concerned about the impact of these? What can it do to address the expiration of these tax credits if they happen?
Yeah, I mean, it's certainly a concern. We as an agency, have focused quite a bit on trying to support greater health insurance enrollment, and we've succeeded in that. We've seen it increase year over year with, as you mentioned, a record-setting year this year, which actually broke the previous record set the year before. So we've really had a lot of high achievements there that we've been proud of, and Wisconsin's been able to maintain a low uninsured rate for a few years because of a lot of these investments. And so it is certainly concerning to see not just the changes to the expanded tax credits expiring, but also many of the changes that are being implemented in this program integrity rule. And certainly some portions of those have been stayed, but as Caroline mentioned, not all of them have. And there are other regulatory changes that we've seen coming out of CMS that impact our ability to make sure that people have access to reliable health insurance coverage through the marketplace and can talk to reliable health insurance agents, navigators, without the funding there for navigators. So there are a lot of pieces at play and a lot of moving parts. I think one of our other challenges is the frequently changing guidance, which I think, Scott is alluding to, where we just saw just a couple of weeks ago, CMS change course on enrollment eligibility for catastrophic plans, for example. Those are new things that we didn't see coming. And our role as a state agency is to uphold state law and regulation when it comes to insurance rates. So insurance rates in Wisconsin cannot be excessive, inadequate, nor unfairly discriminatory. And we have to pre-approve and review rate filings that come into, for the Wisconsin market before they go to CMS. So we do have a federally facilitated marketplace here, but there are pieces of this that OCI plays a role in to make sure that insurers are operating within state law as well as within, CMS's parameters and requirements. This upcoming data correction period, September 30th and October 1st, for insurers to adjust rates potentially on catastrophic plans and other things. This wouldn't normally be happening at this point in this timeline, and it creates challenges for the market overall and for our ability to put together cohesive messaging and communication to the public about what the status of anything is and what the status of their enrollment possibility is going to be and what the cost might look like, because there's so much uncertainty. So we hope to have things a little bit more solidified when we get into October, because obviously then we're knocking on the door of the launch of open enrollment November 1st. But obviously there's also this potential extension of the expanded tax credits or some version of expanded tax credits hanging out there as well, which would certainly be beneficial to policyholders to be able to access coverage and be able to afford that, but does just add to this ongoing chaos in the space of from a regulatory perspective and a logistics perspective for the plans themselves. So there is just a lot of uncertainty that's coming out from a lot of different angles, and this frequently changing guidance is just furthering some of that chaos.
Thanks, Sarah. Tommy, Security Health Plan, which is part of Sanford Health Plan as of January this year, I believe, said this summer in a rate filing that they were seeking a rate increase of around 24 to 25% for each of its 4 products on the exchange in Wisconsin. Can you talk a little bit about what led to that? Is that mostly connected to these expiring tax credits, or are there other factors at work there?
Yeah, well, first of all, let me say it's a delight to be serving the Wisconsin market, and to work alongside security. I think it's been really touched on. I think a lot of that increase in premium is definitely due to sort of the premium tax credits being sunsetted. But in healthcare and healthcare insurance in particular, we've seen over the past several decades just ongoing increases in premiums, and we all know that the cost of healthcare and health insurance has outpaced even wages over the past several decades, and there's a number of reasons for that. I mean, in reality, and sort of maybe contrary to popular belief, health insurers, don't really make a lot of money, and particularly in not-for-profit healthcare like ourselves, we often run a deficit and continue to invest in our communities to support the needs of our communities. So a lot of what we're having to do is really out of necessity, and in response to the environment that we're in. So the premium tax credits is certainly a factor, but it's not the only factor. I mean, we have seen incredible inflationary pressures across healthcare spending. We're seeing sort of with the silver scaling or the graying of the United States, that over 65 age bracket continues to grow in number, and with that comes a propensity for more chronic disease burden, as well as costly care to support that chronic disease. One of the biggest inflationary issues that we're seeing today is the cost of pharmaceuticals, and particularly with some of the new novel medications that are now hitting the market, GLP-1s, cell and gene therapies, other chemotherapeutic agents and cancer agents, are all sort of compounding the problem, and really requiring us to, in order to sustain, coverage for the communities that we serve, to file some of those larger increases, which, from our data, appears to be very competitive with, what we're seeing other payers do in the market as well. So it's obviously not the direction any of us want to go in terms of driving affordability of healthcare in this country, but it is sort of the state of where we are, and how we must respond.
For security, how much do you expect enrollment to drop for the plan in the next year or so, just because of some of these higher prices? Do you have an estimate on how many folks you might be losing, or percentage of folks you might be losing?
Yeah, it's really hard to say. I mean, I think we'll probably lose some members in ACA for sure on the exchange. You know, we are seeing some other market dynamics play out in other lines of business, particularly Medicare Advantage, and I think it's already been said that some payers are also pulling out of some markets across the state of Wisconsin and across our broader geography. So you know, net, you know, overall securities membership may actually grow, you know, even with, you know, with some of these other dynamic changes. But we won't obviously know until it's all said and done. But we are estimating and sort of preparing for some growth in the state of Wisconsin.
Thanks, Tommy. Um, Sarah, does OCI have data on how much premiums are expected to rise? I know Tommy had mentioned that their increases are in line, and the rate filings show that they were mostly in line with what other plans are pursuing in the state. But do you have any ideas yet on what the weighted average would be?
So we usually get that finalized sometime in October, which is hopefully still the timeline we will roughly be on. But like I said, we're having a few more changes come in at the end than we're used to. There is this correction period where there's going to be some re-rate filings for the catastrophic plans. Also related to the actual value de minimis range issue, which was part of this lawsuit that stayed a portion of the program integrity rule that's requiring some of those products to be refiled. Normally we wouldn't have refilings for rates at this stage in the game, but yes, there's still going to be some fluctuation, and then, you know, we'll have a sense of final average rates and rates, you know, and a weighted average, and also rates that account for the impact of the Wisconsin Healthcare Stability Plan, which has held down rates every year that it's been in existence. And hopefully, you know, we'll be able to see that benefit, though costs will still be higher than they would have otherwise been without the program integrity rule and the anticipated expiration of these subsidies. I know the Center on Budget and Policy Priorities did a study last year in preparation for this expiration that was planned for the end of 25. And in their estimate, you know, that population of 55 to 64 was going to be one of the hardest hit populations. I know that, you know, I think it makes sense that that's the population that is more likely to have maybe that higher income level that is facing that cliff at the cutoff for the subsidies. And, you know, one of the statistics that the Center on Budget and Policy Priorities had found was the average 60-year-old couple in Wisconsin making $82,000 a year would see their annual premium increase from around $7,000 with subsidies to $25,000 without subsidies. So there is a real hit that's happening, particularly in a population of people who use a lot of healthcare, and that we like to use a lot of healthcare, that we hope have access to healthcare. So that is an issue that we're tracking in particular for that population of people before they hit Medicare age.
Thanks, Sarah. Tommy.
Yeah, maybe just another comment off of Sarah's comments here. I mean, I think one thing that maybe hasn't been totally said is, you know, the likely population to actually, you know, transition off of the exchange is likely to be the folks that are healthier or have sort of less disease burden, which will drastically alter sort of the risk pool. So it's sort of in addition to the comments that I made earlier about premium increases and sort of the cost of healthcare, you know, as that risk pool continues to, you know, evolve towards a sicker population, you know, the cost of managing that population will continue to expand and increase over the course of the coming years, which will undoubtedly relate to and lead to, you know, more inflationary pressures on premiums. So just, you know, another way that there's sort of the death cycle that sort of, you know, transpires as we get into some of these bigger changes.
Thanks, Tommy. Justin?
Yeah, just to add a little color to what Tommy was saying there that I think is on point. You know, Kaiser Family Foundation has put out a few estimates that are, you know, maybe helpful for benchmarking how large some of these things could be. You know, it's hard to know, and it's going to vary health system to health system exactly who's going to unenroll and everything. But, you know, their estimates are that if everything expires, if the premium tax credits expire, that, you know, in Wisconsin, we might have about 56,000 people come off the ACA plans out of, you know, about 360 313,000 to start with. And they're predicting that that probably leads, generally nationally to kind of 4 to 5% increases in total costs of plans coming from sort of the enrollment mix becoming less healthy over time.
Justin, sticking with you for a moment, is this something that kind of all insurers are dealing with now with these rising costs? I mean, how is the Healthcare.gov market reflecting trends in the market, health insurance market overall?
Yeah. So, I think in general, this is a rising trend this year. So healthcare costs are rising this year faster than they have been in the last few years. So you're seeing reports from, for instance, most of the employer-sponsored insurance market is also seeing reasonably large increases. I think a lot of the national estimates I've seen are kind of putting it maybe in the range of 9% or so. So, they're also going up, but not as fast as what we're seeing in the ACA market. So, ACA markets, a lot of, we don't know the very final rates, but a lot of the initial indicators are, maybe as much as double what you're seeing elsewhere. But I think many of the underlying trends that, Tommy, I think started getting at to some extent in terms of rising healthcare costs hit across the board. Most of these insurers participating in the ACA are also participating in employer-sponsored plans and Medicare Advantage plans and things that all those kind of cost growth are passing through. One kind of point of reference in Wisconsin, where we have a little bit of public information, is the state group health insurance plan for state employees. And there they saw and they work with a number of insurers in the state, and their initial rate requests were about a 13% increase for this year. I believe they were able to negotiate the final numbers down to something more like 5 to 6%, but there is the sort of push this year that's kind of across the board.
Thanks, Justin. Tommy, you were kind of talking a little bit about this already, but Congress is considering an extension of these tax credits. When would they have to act for that to have an impact on rates this year? Like, what would that look like? When would you like to see action by?
I mean, obviously, as soon as possible, to put in place all the preparatory requirements. Unfortunately, we think it's could probably come down to the wire, and we'll hear right before sort of they're set to expire in late December, which will sort of send the industry into a little bit of a tailwind to kind of prepare if that certainly does happen. But we would rather have it late than never. And like I said earlier, I think we're sort of holding out for kind of that optimistic view and making the necessary preparations where we can.
If this does come down to the wire, like what's that going to look like for you all in terms of implementing this? I mean, if this is extended in December, I mean, prices will already be out starting November 1st. What kind of has to happen so that, consumers know about that change, or what can you all do on your end to help them ameliorate some of these large impacts?
Yeah, I mean, some of this is uncharted territory, so we're sort of learning as we go here. I mean, I think, going into this, we've prepared, two different bids, one with and one without, the subsidies. So we sort of know where rates would come in. We obviously filed, anticipating the expirations would come through, but as we're given further guidance, we're ready to sort of proceed with sort of what a new premium, rate might look like, for these plans. If it does certainly come down to the wire, as I mentioned, I think we'll probably need a special enrollment period of some sort, and give consumers probably some time into the first quarter of 2026 to, enroll into these plans. But hopefully, that guidance will come straight from CMS, and from the states that we operate within.
Just a question that had just occurred to me would be, what would be the percentage point difference between what you propose raising plans without the tax credits compared to if they continue? I think it was around like 25% increase without the subsidies. Do you have some idea of what it would be in comparison if they continue?
Yeah, it's a great question. I don't have the numbers in front of me, Sean, but it is considerable. I mean, I think Sarah mentioned, astronomical numbers, in terms of the increases that's largely due to the subsidies, and not some of the, other inflationary challenges that I mentioned earlier.
Thanks, Tommy. Caroline, would you like to talk a little bit about this?
Yeah, and the thing is for us as navigators, we are prepared no matter kind of what the results are, whether the enhanced tax credits move forward or not. Our role is to be there for people when they have questions, and so no question is too big or too small. And we really relay that to all of our partners so that folks are connecting them to navigators, because as all of this changes, it's not going to be the consumer that follows this policy and knows what to do next. And we have a network that we're very proud of here in Wisconsin, where we have agents, brokers, enrollment certified application counselors, and then of course our Covering Wisconsin health insurance navigators that are meant to help someone from part A to part Z in this process. And no matter kind of what the results are, we're here to help.
To follow up on that, Carolyn, are you planning, or has Covering Wisconsin put any sort of contingency plans in place in case these tax credits are continued, in terms of how you communicate that out to folks so that they know when it kind of happens?
In terms of our public messaging, not necessarily, but of course our navigators are staying up with policy. We just finished our Wisconsin Enrollment Conference where we discussed kind of what could happen and what we expect will happen, at least as of now. And then we have internal resources so that our navigators are equipped to essentially help guide folks to information that helps them make the best decisions. We don't push someone into one plan versus another, but our role is to help kind of understand what those choices are so that people are not just looking at what economically makes sense for themselves, but also what benefits their healthcare outcomes.
Thanks. Sarah, if these credits are extended, what's that going to look like on the state's end? Like, what will you have to do to either modify rates or to get the word out to consumers who might be seeing some pretty high price increases?
Yeah, I think I would just echo, what's already been said. It's uncharted territory. I mean, we've had a lot of conversations also with other state regulators across the country are dealing with the same disruption at the federal level and the same uncertainty, in these regularly changing guidance that we're all navigating in real time. And we've had conversations about what it would look like. I think some of that might depend, potentially Congress could act and extend the subsidies and maybe define along with that extension how that is implemented and what the operationalizing looks like. They may not, and then there will be conversations between state regulators and CMS around what that could look like. But I think it remains to be seen exactly how that would be put in place, at what time. Like you're saying, if something happens in December, people have already enrolled for a month and a half potentially by then. So is it just a special enrollment period sometime in 26 with new rates and everything starts again? I think we have to just sort of see what happens, see what guidance we may or may not get from Congress if they choose to extend the subsidies in their current form or in some other form, and then coordinate on messaging. We do through the governor's OCI DHS healthcare coverage partnership. I work with Caroline all the time through that group, and agents and companies and other navigators around the state and other advocates on a regular basis to coordinate all of that. So we do try to adjust to new guidance and changes that come up. And I imagine we would have, maybe a series of some emergency meetings of that group if there's a last minute change in subsidy extensions, so that we can make sure we're putting together a comprehensive communication and outreach plan to get information to people as much as we can. I mean, we are certainly challenged by the fact that the cut navigator funding has been cut so significantly. That's been a network we rely on. Those are, great experts. And that's certainly a challenge to not have that available to us in the same way it has been. But we'll do the best we can if we need to make changes to any communications we're putting out there, because consumers do, they see what's in the press, and sometimes they end up deciding not to enroll in coverage or not to pursue it if they think it's unaffordable, or if the last thing they heard was that it would be unaffordable. So we do want to keep that in mind if there's a chance that these are extended, that people know to shop around, look again, all those things, so that they're not just, scared away from looking into the marketplace because of their assumption from the previous news cycle that said it would be unaffordable.
Thanks, Sarah. I wanted to transition a little bit to talking about some of the service area changes and insurers exits that we've seen or know of. Of course, community health plans, which is the insurance arm for Children's Wisconsin, as it said, they're exiting the marketplace. Molina Healthcare said in the filing that will offer, quote, one gold off exchange plan in 2026, end quote. Common Ground Healthcare Cooperative is pulling back in about 11 counties and reducing their footprint there. Caroline, are there parts of the state you're concerned about that might have fewer carriers? I mean, what's your assessment of these departures and the impact they might have?
Yeah, absolutely. This is something that we track every year to see essentially by county how many plan options are available and how many companies are available, because that obviously pertains to health insurance networks and where people can go for their care. And a lot of times we want to make sure that people can go where they would like and maintain their relationships with their doctors, because that's how people have better health outcomes when they have a medical home. And so with some of these changes and knowing that maybe we haven't heard all of the changes, there's still some uncertainty of whether there or not will be more than what is already publicly available. It won't be until everything is essentially finalized and available to navigators for our own assessment to really get a good grasp of how this is going to impact all the communities that we serve. But we're already concerned in terms of some of the changes, especially in kind of that eastern part of the state where a lot of the Molinas, the Common Grounds, have a lot of quite a footprint, Chorus as well. And so we're already talking about for those networks that they serve, where can we pivot people and make sure that they know that if they want to continue on with those providers that they've been with, that they're still able to. And that gets harder as those numbers minimize.
Thanks, Caroline. Sarah, OCI releases a map usually in October showing service area change. Well, showing what plants are in what counties. Is OCI concerned about some of these departures? Are there any parts of the state that are going to see reduced competition, and what parts of the state will see that reduced competition?
Yeah, well, as Caroline said, it's things are still in flux and they're not finalized yet. And to your point, we do update our map, and we will do that as usual once those things are finalized and we get the certification from CMS, which plans are participating, where they're doing that, all those final agreements are put in place. We definitely are paying attention to that, the service area changes as one of the many changes that we're seeing related to as a result of this disruption. I think the risk pool issue is a big contributor to some of the service area changes. As the costs go up without the subsidies in place, and as maybe the people that assume they're going to use the most healthcare decide to stay with their health insurance, and the 26 to 35-year-olds that feel they don't need it choose not to have it anymore because now their premium is more expensive than it used to be. I think that's what's contributing in many of these cases to carriers having these challenges with operating in the same service areas that they've had for in the past. Wisconsin's had the second most competitive market in the country for several years. And that's something we've been really proud to maintain. I think we'll have to see what happens when other states, the dust settles in other states as well as here to get a sense, but this is happening nationally. So I'm kind of curious to see what those changes might look like across the country as well. We have been able to maintain a competitive market. So even with some of these service area changes, hope that there's still sufficient competition in as many counties as possible for people to have multiple options on the marketplace to still get the care that they need and have sufficient networks in those areas.
Thanks, Sarah. Tommy?
Sorry about that. This is something that I'm gravely concerned about. And I think you sort of had to ask yourself, why are these carriers exiting, these markets? Obviously, the sort of the economics of managing those distinct populations has become much more challenging for those insurance companies. And as a result, a lot of that membership will transfer to a much smaller number of regional payers, which will have to sort of absorb some of those challenged economics. And I worry about sort of the long-term impact of that, and sort of the sustainability of maybe smaller regional payers like security or other plans that could be in the community, staying strong for the community, but challenged by kind of the disrupted economics that sort of that shift might bring. So this really does require sort of an intentional focus by the state, by CMS, to come up with sustainable solutions to ensure that we can be there for the long term.
Thanks, Tommy. Just out of curiosity, is security planning any service area changes that are significant? Any expansions or contractions?
No contractions. We are committed to the communities that we are serving today. Obviously, we're eagerly sort of anticipating, the changes that we've just described to see what, if anything, we might need to do in subsequent years.
Thanks, Tommy. Justin, can you talk a little bit about what this reduced competition could mean for consumers? Would you see impacts this year, or is this kind of more of a long-term impact?
Yeah, it's, in terms of the big impacts, I think everybody's already hit on the sort of disruptions to access to networks that you're used to and being able to see the doctor. And there's a lot of good work in sort of health services research sort of showing just how big an impact it can have on people to lose access to a doctor. And those sort of disruptions can have a lasting effect for a while. In terms of the kind of underlying competitive economics of, sort of what happens when one of these insurers comes out of the ACA, I mean, there is certainly, obviously competition tends to help lower prices. And so, the fact that we do have a competitive marketplace does, help keep down some of the costs. But as Tommy also mentioned, the profit margins for health insurers are not typically massive, and they are somewhat constrained by other policies within the ACA. And so, some of the other impact on this can also ripple through into how the negotiations go between the insurers and the healthcare systems and the sort of prices they're able to negotiate. So, in Wisconsin, that's a more complicated thing than it is in some other places where there's more integration between insurers and healthcare systems, where there's some joint ownership. But in general, it's a little hard to say economically whether some of this decrease in competition and potentially increase in concentration in some of the insurer levels in some parts of the state may actually give the insurers some additional leverage for bargaining power. That said, the ACA market is still overall a relatively small part of things, so that impact on their ability to negotiate may not be enormous.
Thanks, Justin. Just as kind of one of the things that the Trump administration has been doing in response to this is working to make catastrophic plans and short-term health plans more available. What impact would these have on consumers and these efforts have on the marketplace in general?
Yeah. So, I can give a first thought, and others may want to weigh in on this a little bit. Catastrophic plans, they have large deductibles, often, in the range of sort of $10,000. For many people, those are not particularly attractive coverage. It may be better than having nothing. And, it may be important for sort of keeping some people from needing to access, for instance, the community health centers as much if they enroll in those. But in general, it's going to be fairly unattractive to a lot of people. And historically, there hasn't been very large enrollment in those. So, I think one thing that I would worry about a little bit is some people potentially enrolling in them due to the immediate premium shock that they're seeing from the increase in the coverage they've had, but sort of not fully appreciating just how much less coverage they're getting in those plans, and and the impact that having a $10,000 deductible may have on their healthcare decisions. So, those plans have to cover some preventative care visits, but as soon as your doctor starts, asking you to get some labs done and go see a specialist for something, then having to pay that full price in a way that some of these people will not have been used to, I think could end up being sort of a bargain where people end up regretting their choice if they go into those simply by trying to minimize their premiums.
Scott.
Yeah, I think for me, I think the biggest piece when I think around any of these policy decisions is, are we really addressing the root cause of the issue, right? And so for me, catastrophic health plans can be valuable, right? Maybe if you're transitioning between a job, right? Or a short-term plan can be helpful if you're like, hey, I don't want to pay $2,000 a month for Cobra, I can go on this catastrophic plan. That's honestly what I did when I moved to Wisconsin. Like, that was great for me, but that's not great for the actual delivery of care and for actually increasing access to preventative care services, all these pieces that we know actually keep the cost of care down. And so as I look to our federal representatives, as I look to all of the things that we do and to the people who are making these decisions, is what's the actual goal of these plans that you're either investing in or making, putting online, right? Are they actually addressing the root causes of these high drivers of care and the high drivers of cost in the healthcare system? They're not. Quite frankly, the catastrophic plans are not going to help with that, right? And so how do we get back to not maybe, I feel like in this current environment, we're regressing back to 2013, right? Before the ACA, like we're just always doing the thing to hack away from the ACA, which has made really beneficial plans and getting people access to care. And so as I think around this, it's what's the end goal? What's the policy goal? What are we doing to actually address these issues and not just, politically hacking away at things that we didn't like more than 10 years ago now. And so how do we get back to what is our vision for healthcare in this country? And I just don't feel like any of these plans and what's going on in this industry right now is really helping us get to that next level. It's really regressing us back. And then that just concerns me, I think, as someone who's looking at how do we actually increase outcomes and quality of care in our country, right?
Thanks, Scott. Caroline?
And I agree, Scott, completely. And I think what we also then have to ask ourselves is, what are the ramifications of these changes, not just this year or the next, but down over time? Because when people are, essentially deciding around prices that they can afford, but then out-of-pocket costs that really are truly unaffordable, then we have people that come to our navigators, that come to us, and then they say, oh, I had this plan, but I didn't go to the doctor once all year because I didn't want to have to pay anything. And what that then results in are people avoiding getting care that they need, whether it's for preventative care, whether it's for chronic care. And then when it's in terms of an emergency situation, they end up in the ER. And we know as healthcare professionals what that means when people are getting their regular care in our emergency rooms. That means costs overall go up, and that means just healthcare outcomes are very low. And when you have communities, and I, am in Milwaukee County in particular, and so when you see that there's already healthcare disparities in terms of communities of color and other groups of folks where they're already waiting for care and they already get late diagnoses for chronic conditions that are life and death type of conditions, then we see people die. And that's unfortunately the result of some of these choices that we're seeing be made. And so for us, it's of course important that we're making sure that people are making the best choices that are available to them. But the choices that folks are having to make are very grim. And what I would love to see is a really tough look at really what are our goals, as Scott said, and making sure that these policies are really looking out for the well-being of our communities.
Thanks, Caroline. Tommy, just wondering if you could talk a little bit about this approach towards boosting access towards catastrophic plans and short-term health plans. How would that affect security?
Yeah, I mean, I agree with my colleagues. I don't know that there's really much more to add. I mean, I don't know that there's, I don't know that that really solves much, as has already been said. I mean, coming at it from a clinical perspective, I mean, we have a really good sort of baseline benchmark, if you will, just looking at the performance of high deductible health plans and how, that's played out. And those have been around for a really long time. We know that people don't go to their doctors. We know that preventative care goes down. We know that access also drops, and with that comes significant comorbidity that doesn't really improve the overarching goal here of improving health. So, while I think it's already been said, I believe Justin noted, it's nice to sort of know that there's some security there in the case you do have a catastrophe. It doesn't really improve the overall well-being or the health of that member. So, not a huge proponent, obviously, of that for those obvious reasons.
Thanks, Tommy. Scott, I wanted to circle back to something you mentioned earlier about Medicaid and some of the changes that are happening there. Can you talk a little bit about how this market kind of interacts with the Medicaid market? There's a whole series of changes that have been proposed that have been approved at the federal level for Medicaid. What are you expecting to see as the impacts for the ACA?
Yes, and I'm really happy that you brought this up because I have been tracking particularly one area of interest that in my mind, right, like again, and I think, even in the state, right, we have two separate departments handling, marketplace plans and then one handling like what's happening in Medicaid and food share. But really when you look at the system, right, it's interconnected, right? And so for me, obviously ACA is the first bite that we're going to see around a lot of these changes that are happening from particularly the reconciliation bill. And so those ones come real fast and furious. We are going to see most of the Medicaid pieces happening starting in 2027, right? And so we're going to have to really, I think, but that doesn't mean that people aren't going to be concerned or have information available that they think is wrong. So we're having to make those plans already to make sure that the information is correct. But one thing I think is really important to highlight, I think, is again, like interconnectivity in the bill, even on what happens between Medicaid and marketplace. So an example of that, right, is that one of the provisions that was worked in was, let's say when work requirements get required, our community engagement requirements are implemented for Medicaid in 2027, if for some reason you do not hit your work requirements or are kicked off for not hitting work requirements, you are then not eligible for those ACA tax credits, right? So now we're seeing not only are we kicking people off of insurance that for many multitude of reasons, so administrative, all of the different barriers that we put up to get people access to the Medicaid program. Not only that, but then we're saying, hey, well, then we have this other option for you that could have been available, but now you can't even get that, right? And so how does that, again, help us in our overall goal? It is just thinking around how, this consistent theory that people are just abusing the system consistently. And while I don't disagree that there's some waste and abuse in the system, like how does that actually help us get to the goal? And so those are the things that I'm tracking. I think that's things that, again, I think I urge on the federal side, our legislators and our folks to think around how are we actually like hitting our goals as a system of healthcare. But on the state level, I also encourage us to think around how do we just redefine collaboration in this moment, because these things are not separated in practice. They're separated in department levels, or they're separated, in different regulatory bodies, but they're not separated in practice. And so I'm not saying that that's not happening now, but I just encourage us to even think maybe how do we get even further to that next level around collaboration, because I just see, this whole system is going to be rocked. And that's a time that can be really challenging. And I think lead to people retreating back to their corners, but it can also be a time for us to come together in new ways of working. And I would rather us do the latter than the former, right?
Thanks, Scott. We're fast running out of time. I kind of wanted to do maybe a little bit of a lightning round with panelists to kind of round things out. So Scott, maybe starting with you, can you talk about, I mean, what's like one thing you'd like to see state and federal officials do to kind of help consumers this open enrollment period, or potentially, what is one thing that your organization's doing to kind of help people navigate this situation?
Yeah, so I think, we do have, opportunities in varying areas. So I think similar to, Carolyn is, covering Wisconsin, yes, did lose money, but obviously people are picking up slack where we can. And I think it requires us to rethink how the system operates. And so I encourage, what our state and federal officials, I think, is the best option that we can think around is how do we make sure that we're bringing people together appropriately, right? Similar to how we did through COVID, through public health unwindings, how do we bring people together in a really meaningful fashion, and how do we utilize our partners in the best way possible? I heard that, from Sarah at OCI as well. It's like, we want to utilize those partners well. I heard it from Carolyn. I heard it from everybody at this call. And so I just encourage us to continue to think around how do we leverage the people leverage the partners, the people on the ground who can provide additional pieces that maybe, are going away in other capacities. And so I always think around that collaboration piece again.
Thanks, Scott. Sarah, what's one thing that, OCI can do to kind of help consumers this upcoming enrollment period?
Yeah, I mean, we will certainly continue to leverage all those partnerships that we've built through the governor's healthcare coverage partnership that he created back in 2019. He created that right before the pandemic hit, and we were able to maintain a really strong partnership around not just through the pandemic, but also during the unwinding, which I think is relatively unique to Wisconsin. So we'll just continue to have that collaboration between our two agencies to coordinate as best we can to get people to coverage. Because yes, all these changes at the federal level aren't necessarily geared toward keeping people covered and ensuring they have access to healthcare. We're going to do the best that we can to communicate the ways people can get access to healthcare and find ways that we can connect them from one source to the next source if they lose Medicaid to Marketplace and other options.
Thanks, Sarah. Justin, what's one thing that folks can do to kind of help people stay covered in this upcoming enrollment period?
So, I think what Sarah just mentioned is probably going to be the crucial thing, in the short term, is just finding ways of helping people, recognize and overcome the small barriers. So if you've lost your insurer, how do you find the next one? And, in the landscape right now, that's a challenging thing to do, but I think anything that can be done to do that is important. I think in the longer run, the key thing is that actually the big tensions are on the overall cost of healthcare. And so, I'd urge our policymakers to really be focused. I think Scott was hitting on this, on policies that are fundamentally aimed at addressing the underlying root costs and not sort of thinking so much about the coverage side of this.
Thanks, Justin. Caroline?
Sure. I want folks to know that Covering Wisconsin is still available, that our health insurance navigators are still available, even though we may have less of us. We still have a robust enrollment assister network across all of our different community partners, and we still serve all 72 counties. And if people get to us, we will make sure that they get where they need to go, whether it's helping them one-on-one with health insurance enrollment or getting them connected to, healthcare providers, to the income maintenance consortia for Medicaid or what have you. We don't just send folks off. We believe in warm referrals, and they can reach us on Wiscover.com or our coveringwi.org website, or of course by calling 211. It's the easiest thing to remember to get connected to their local enrollment assisters.
Thanks, Caroline. Tommy, you mentioned at the onset that you were an optimist. Can you talk a little bit about what you're looking forward in terms of action for?
Yeah, I mean, I think like anything, a lot of what we deal with is cyclical, and I feel confident that we'll emerge through this at some point in time in the future. Hopefully, it's not too much of a protracted time, but I want to say thank you for the opportunity. Want to say thank you to Sarah and OCI and in particular our state partners and the rest of the panelists. I think some really good conversations here. I mean, we're going through a really tough time, and I think as an industry, we need to try to band together and stay connected as best as we can and be there for our members who are undoubtedly also feeling a lot of confusion and uncertainty as well. So we're partnering with our agents and our brokers, really opening up our distribution channel to answer questions and to be there when they need us most. So we'll get through it, but I appreciate the opportunity.
Thanks, Tommy. And thanks to all the panelists for taking some time today to talk with us. Our next event, if you want to hear more about health insurance, we're doing a health insurance CEO roundtable in a few weeks in Madison. That'll be in person. So once again, thanks everyone for attending, and thanks again to our panelists for participating.
Thanks, everyone.
Thank you.